All across the world, heart disease is becoming one of the leading causes of death. It is often called the silent killer because of its sudden onset. Heart disease includes things like high blood pressure, high cholesterol, and it can lead to heart attack and stroke. This animation will give you an idea of what happens when the heart functions normally versus what happens in cardiac arrest when the heart stops completely. Under normal conditions, the heart functions as a pump to distribute oxygenated blood from the lungs to the rest of the body. During cardiac arrest, this pump action stops completely. Hence, vital organs such as the brain are not getting the oxygen it needs. This is where CPR, or cardiopulmonary resuscitation, comes in. CPR is used to manually mimic the pump action of the heart so that blood can continue to flow to the vital organs of the body. Now let's hear from Dr. Taposh Mondal about some of the facts about heart disease.
Around the world, a lack of knowledge surrounding CPR and CPR practices is having detrimental effects on the survival of patients suffering from a cardiac arrest. In these cases, CPR, which stands for cardiopulmonary resuscitation, is a basic, inexpensive, and effective tool that can be used to significantly improve survival rates. Some people wrongly hold the opinion that CPR can only be conducted by a medical professional, and that too within a medical setting. In fact, it is highly encouraged that even bystanders learn to use CPR in order to apply it in necessary situations, as cardiac arrests happen outside the hospital in as many as 85% of cases. Actually, one should start CPR as early as possible, as the first 5 minutes after cardiac arrest are vitally important. In such a short span of time, emergency services may not be able to arrive at the scene. By learning CPR, you will be equipped to start CPR in an emergency situation and save a life.
Now, it's not all bad news. Today, we have new advances in early detection of heart disease symptoms, immediate response, and long-term treatment. Today, we'll be focusing on the immediate response component, or hands-only CPR. Now, this is also called continuous chest compression CPR or compression-only CPR, and it can be done by anyone after today's training. This technique was pioneered and researched by the Sarver Heart Center at the University of Arizona. Now, CPR is used in cases of cardiac arrest where the heart has stopped working, and this can be caused by a heart attack or other conditions. Let's start by talking about how to identify the need for CPR. First, check for responsiveness, and then check to see if the patient has a weak or no pulse at all, as this is a sign of cardiac arrest. Now, there are two types of CPR, traditional CPR and chest compression only CPR. Today, we're going to be talking about continuous chest compression CPR because this is the default type that can be used in most cases of cardiac arrest. Traditional CPR is reserved for drowning victims or children under the age of 2, as the airway needs to be cleared in order to prevent long-term damage to the body. Now, I want to emphasize that CPR is a temporary means to prevent damage to the body. It is not a cure for cardiac arrest. The patient ultimately needs to receive an electric shock to restart the heart, and this can be done at a hospital or through an AED. Now let's hear from Joe McCormick from Celtic Systems about some of the advances in medical training through cell phones and tablets. Today, we'll be using one such system called iLearn at Celtic, and he is here to introduce this to us.
Hi, I'm Joe McCormick, and I'd like to introduce you to a new mobile product, iLearn at Celtic. We are proud to sponsor the CPR training program by providing the equipment and software. This new iLearn at Celtic product runs on various mobile platforms, such as cell phones and tablets. Thank you, and I hope you have a great training experience.
According to the American Heart Association, it is suggested that one should be able to properly conduct CPR after having watched a video tutorial. While we agree with this statement, we also suggest that this knowledge be supplemented with an interactive, feedback-based learning system in order to enhance understanding and increase comfort in performing CPR. With that intent, we have produced a multilingual module series, including a practical demonstration of hands-only CPR, pre and post video questionnaires, and post-demonstration questionnaires that will help you to master this skill. We recommend that this knowledge be supplemented with practical training. We hope that after this session you will be able to train others in this skill.